Bismillahirrahmanirrahim. Assalamu alaikum. A 54-year-old woman, gravida 2, para 2, come to the office due to involuntary loss of urine. She says, whenever I laugh, cough, or sneeze, I am unable to hold my urine. I am afraid to leave the house. The patient has no loss of urine while sleeping. She tried pelvic floor exercise for 8 weeks with no improvement. She had a total abdominal hysterectomy 4 years ago for heavy menstrual bleeding due to fibroid. 3 years ago, she experienced occasional hot flashes for approximately 2 years but decided to not begin hormone replacement therapy. The patient is sexually active with her husband. She has no other medical problems and take no medication. Examination show vaginal rogue. Urinary teeth show no abnormalities. Which of the following is the most beneficial long-term management option for this patient? So this patient is 55-year-old woman, gravida 2, para 2, come to the office due to involuntary loss of urine. She says that whenever I laugh, cough, or sneeze, I am unable to hold my urine. She tried pelvic floor exercise for 8 weeks with no improvement. On urine lysis, there is no abnormality. So based on these hints, what is the diagnosis of this question? The diagnosis of this question is stress urinary incontinence. And the management option for stress urinary incontinence is urethral sling surgery in this case. So here the correct option is choice F. This patient has the classic presentation of stress urinary incontinence, which is characterized by urine loss with increased intra-abdominal pressure, for example, laughing, coughing, sneezing. Pregnancy, childbirth, obesity, and menopause are risk factors for weakening of the pelvic floor muscle that lead to loss of the bladder, neck, and bladder support. Kegel exercise can be helpful. A vaginal pessary is non-invasive therapy for poor surgical candidate. Most beneficial long-term treatment is urethral sling surgery, which has high cure rates. Come to the incorrect one, intermittent self-catheterization. So intermittent self-catheterization is used for urinary retention due to neurogenic bladder. Alpha blocker. So alpha blocker is used for bladder contraction. Choice C, oral antimuscarinic agent. So oxybutynin is antimuscarinic agent for the treatment of urge incontinence. Choice D, oral cholinergic drugs. So cholinergic drugs, for example, bethanicol is used to treat overflow incontinence due to diabetic neuropathy. Choice E, oral hormone replacement therapy. So oral hormone replacement therapy is not recommended for the treatment of incontinence. Thank you.